This could positively affect our 2025 UMP Classic Medicare with Part B premiums. This meeting, like our others, is hybrid. Healthcare Authority staff will be on site, and board members and other attendees have the option of attending on site or via Zoom. Our Zoom attendees can see our opening slide, and it has the information about how attendees can turn on closed captioning subtitles. Pursuant to the Open Public Meeting Act, Chapter 42.30.0803, RCW regarding special meetings, final disposition will not be taken on any other matter in this meeting. I'd like now to do board member introductions, and I'll do a roll call to identify the board members with us today. And board members, I remind you to come off mute. First, I'll call on Harry Bossy. I believe Harry and I already talked. Harry?
Here.
Thank you. Tom McRobert, I see you in the room. Tom, I can't hear you. Let's try that microphone.
Oh, yes.
Okay. Thank you. I just want to make sure for the recorded message, or anybody that might just be listening in on audio. Michaela Dolman.
Here.
Hi there. Elliot Weinstein. Elliot, I know you're on because you have 5 cats with you, but I think you're still on mute.
Okay, I'll try.
Oh, there you are.
Yep, here.
Thank you. John Comerford.
Here.
Thank you. John. Kurt Spiegel. I don't hear Kurt. If you're on, you're not on yet.
We don't see Kurt on yet. We didn't have confirmation if he could or couldn't attend.
Okay. And then I believe Sharon Lang is an absent, correct?
That is correct.
Right.
As a reminder, quorum is 5 voting members, which we do have present, so we can take action today. So that's good.
Thank you, Dave. And also Michael Tunick from the Attorney General's office. I see you there.
I'm here. Thank you.
Great. And I'm Sue Birch. I'm the director of the Healthcare Authority and chair of the PEB board. And with that, let's see. With board members attending both in person and virtually, it would be helpful for the board to hold their questions until the presentation is done or when the presenter pauses and asks if there are questions. Board members attending virtually we will watch in case you use your Zoom's raise hand feature to indicate you have a question. There is one resolution scheduled for action as at today's meeting, and the public will have an opportunity to provide comments on this specific resolution during our normal procedure before the board votes. The public will also be able to provide general comments at the end of the meeting during the public comment period. As a reminder, if the public has questions during a staff presentation, the presenter's contact information is included at the end of their presentation, and the public is always welcome to email presenters during the meeting to capture their question for a response after the meeting. Dave is now going to provide an overview of today's agenda. Dave, over to you.
Good morning, Chair Birch and members of the board. It is unusual for us to have a meeting in August and to have a special meeting. We bring up the fact that it's a special meeting under the Open Public Meetings Act because there are different rules for special meetings versus regular meetings. In a special meeting, you can only discuss and take action on the topic that is published on the agenda in advance of the meeting. And so the only thing on the agenda today is to talk about the development from CMS as it relates to UMP Classic Medicare Part D's premiums for 2025. And we do have a resolution that we both hope to have introduced and acted on in this meeting, which is also unusual. We do have a long history of trying to have an introduction in one meeting and vote in a subsequent meeting, but under these circumstances and are pivoting into open enrollment, it was a close call to be able to even squeeze this part in. So we're asking you to hopefully take action given the nature of the information, which is dropping premiums. We feel pretty confident that you'll feel comfortable with taking action and hearing why at the same meeting. And with that, I'll just remind us if we have an emergency here at HCA, we're going to walk diligently across the street into the parking lot. And that's my only additional reminder. So back to you, Chair Birch.
Okay. At this time, I'd like to talk about our agenda item, the UMP Classic Medicare with Part D, which some people refer to as PDP 2025 Premium Revision. Ellen Wolfhagen's our retiree benefits manager in the ERB division, and Molly Christie is our fiscal analyst in the financial services division, are bringing us information and a resolution revision to lower the 2025 UMP Medicare with Part D premiums. After Ellen and Molly review the resolution with us, I'm going to ask for a motion to adopt and a second. Then I will call for public comment on the resolution, and I will ask for discussion from the board and until we are ready for a vote. So Ellen and Molly's materials are behind tab 3. And Ellen, over to you. I bet you're going to start us off, and welcome.
Very quickly, we realized that Molly's going to pick up the lion's share, but Ellen's here for questions. So we're really going to have Molly take the lead.
Okay.
We kind of decided that after finishing the agenda for you. So sorry about
That's
that.
fine. And I do want to just call out before Molly takes over that Dave and the staff have worked really tirelessly. When this news hit very precipitously, they quickly turned into action to create a benefit and to get on top of this issue. So Dave and team, thank you, especially to Ellen and Molly, who I know were working with our AGs and everybody to figure out the impact. Molly, over to you for UMP Classic Medicare with Part D premium revision.
Great. Thank you, Chair Birch and members of the board. It's good to be back under these circumstances. So I'm Molly Christie with our finance division, and I'm here to present a revision to the 2025 UMP Medicare premium for action by the board. Move on to the next slide. So before I present the revised premium, I do want to provide some context for this change. On July 29th, so this was just 1 week ago, there were 2 significant updates to the Medicare Part D program released by CMS that affect the 2025 plan year. These include a higher than expected increase in the CMS direct subsidy to Part D plans and the creation of a new payment demonstration for Part D plans. I'm going to talk about that second piece, that demonstration, in more detail in the following slides. But together, these changes allow for an approximately $34 decrease in the UMP Medicare with Part D monthly premium for 2025. Next slide. So as I mentioned, last week, CMS announced this voluntary Part D payment demonstration, and it provides additional federal subsidy to Part D plans in 2025. This results in lower beneficiary premiums. And we know right now that the demonstration runs through 2027. However, CMS will reassess funding for 2026 and 2027. Part D plans that are not part of Medicare Advantage plans, so Part D plans that are not MAPDs, are eligible to participate. What this means is that UMP is eligible, but our MAPDs, so our Kaiser plans and our United Healthcare plans, are not eligible. And so CMS has shared that the intent of the demonstration is to stabilize Part D premiums and minimize beneficiary switching plans during the initial implementation of the Inflation Reduction Act. As a reminder, the IRA included significant Part D benefit enhancements. We've talked about these a lot this board season. There's the $2,000 maximum out of pocket and the elimination of the donut hole. And these take effect in 2025. That means that there were significantly higher premiums on the Part D individual market, and CMS is presenting this demonstration as a way to kind of minimize some of those impacts in the first year. Participation in the payment demonstration is at the CMS contract level. That means that MODA, as the UMP Pharmacy Benefit Administrator, will be participating through its contract with CMS. So on July 11th, the PEB board authorized the following Medicare premiums. As you can see, the authorized premium for UMP Medicare with Part D was $453.21, and that's per subscriber per month after application of the $183 Medicare explicit subsidy. Next slide. So this slide shows the rate as of July 11th, which I just presented, and it's compared to the updated rate presented for action by the board today. You can see that the monthly single subscriber premium has decreased by almost $34. So we're comparing that $453.21 to the revised premium of $419.36. You can also note that the Medicare explicit subsidy in both instances, excuse me, is still $183. So we're still at the maximum subsidy cap, but the premium is decreased by $34. So I'll reiterate that the reason for this decrease in the premium is a combination of the increase to the Part D explicit subsidy, or excuse me, direct subsidy from CMS and participation in the CMS demonstration. And I want to pause here. I've been moving pretty quickly and see if there are any questions by the board.
Molly, as we see if there's questions, I do want to highlight one of the reasons we wanted to have the board meeting today is CMS announced the demonstration last Monday, and you have to sign up by 11:59 p.m. today. And we thought it was more appropriate for the board to hear this and authorize the premiums before MOTA officially signed up for the demonstration on behalf of the contract. So it was a very short timeline. And similarly, we are thinking that, CMS releases information in the July, August area. And so, something like this could happen in future years. So we may think, and I'll talk about this a little more when we get to the resolution language itself, about in future years asking the board to pass like a not to exceed rate. That way, if something comes in last minute, there's not a scramble from the agency to understand something and bring it to the board quickly, but get some flexibility from the board to lower the rate if there's information that allows us to lower the rate as we get closer and closer to open enrollment. But for today, we just wanted to introduce people to this whole concept. This is one of those interesting parts about switching to a Part D plan coverage and being able to leverage a federal program. If we weren't part of this program, if the board hadn't made the decision earlier to switch to a Part D for UMP, this demonstration that was announced last Monday wouldn't have even been able to be considered.
Elliot, I see.
Yep, go ahead.
I'm sorry, Dave, I thought you were finished. Go ahead.
I was done. Sorry.
Okay. Elliot, I see your hand is raised. Go ahead.
Yeah, I have two questions. Although I think I know why this decrease in premium happened from the Medicare. And my question is, what's going on at Medicare that they were able to do this? It's maybe this happens all the time. Obviously, I think it's related to the Inflation Reduction Act, but I don't get it. I don't really get why. And then the second thing is this participation or this demonstrate, whatever it's called. Are we a part of that? And what does that entail? I think I know, but it's kind of dangerous when you think you know and you really don't know. Thanks.
So
Yeah.
I think the question to Molly is, can you explain a little bit more about why did CMS do this, and then a little bit more the mechanics of the demonstration, please?
Yeah, definitely.
Thank you.
So I think that there's a lot going on. I think that there are some parts of like why CMS did this that we can speculate on that we don't know with certainty, and other pieces of context that CMS has been more explicit about. So they have explicitly come out and said, we want to make sure that because premiums on the individual market for Part D plans are increasing in 2025, and they are increasing because the benefit is more comprehensive, the benefit is more generous under changes made by the Inflation Reduction Act. We want to make sure that people on the individual market aren't switching plans like crazy, because what happens when you have significant switching is it makes it very hard for those plans and the actuaries that are rating those plans to project what the costs will be. And when there's a lot of uncertainty in projections, it leads to even higher rates because a plan doesn't know what type of population they'll be covering and what their underlying risk will be. So I think what CMS is trying to do is to say, we're going to inject additional subsidy, additional funding into these Part D plans to allow them to keep their rates a little bit lower. And hopefully by lowering their premiums, people that are enrolled in those plans won't decide to switch plans. They won't shop around to try and find a less expensive plan. And that will kind of stabilize premiums throughout the implementation of these changes under the Inflation Reduction Act. So I think that that's what they're, coming out as their intention for the demonstration. Things that we speculate on, of course, are, it's an election year. And so I think that there are some optics involved with that. But really what we've done a lot of research on this in the past week. And for employer group waiver plans that are like UMP that are allowed to participate in this program, there really is not a downside that we can identify. So it appears to just be an advantage to employer group waiver plans.
Molly, I'm just going to step in and add that the one piece of work that the agency or MOTA in particular might have to do is to sign up for the demonstration, you have to be willing to provide data in the future. But the description of that data, which seems it's presumed to be much of the same data that is already reported to CMS, it might be a little bit more robust on enrollment or switching or something about that sort. But there does have to be a promise for supplying data that CMS requests during the demonstration. So that's really the only work, but that would be required by MOTA.
Thank you. I'm going to call on John, and then I have a question as well. Go ahead, John.
Yeah, I had a question relative to Plan G and Plan F. If retirees are on those plans and go after a separate Part D, will they be affected at all by this?
Sorry, can you repeat the question?
Sure.
Molly, I can take this one. John, the answer is maybe, because this demonstration and this additional subsidy during this project or this demonstration project applies to standalone Part D individual market plans. If the plan has signed up for the demonstration. So on the individual market, there is another provision in the demonstration that requires a cap on annual premium increases, which may make some plans hesitant to take part in the demonstration. That cap provision doesn't apply to AGWIPs like UMP. So there's an extra catch or consideration that an individual market plan has to think about, but there will be presumably some individual market plans that sign up for the demonstration and grab this additional dollar and commit to not raising premiums more than the cap that is set in the demonstration. But there will probably also be some individual market plans that don't. So it will have ripple effects in at least parts of the individual market, and that will in of itself trickle over to members who then sign up for a Part D plan in conjunction with their PEB, F, or G plan. Is that helpful to John?
Yep. Thanks, David. Appreciate that.
So, David, Molly, this is Sue. My question is, could you just please restate again which plan this applies to, the reduction in premium, so that people are crystal clear that this is only occurring in certain plan?
Yeah, so this only applies to UMP with Part D. The demonstration is not available to Part D plans that are combined with Medicare Advantage. So the Medicare Advantage plus Part D or MAPD plans are not eligible to participate. So the only revision in premium that we're presenting today is to UMP.
Thank you. The demonstration does not roll into our Kaiser plan. It does not roll into our United plan. That's correct? Thank you, Molly. All right. Jessica or others in the room, do you see any other hands up? I do not. Are there other questions from the board?
Molly does have a few more slides before we get to a resolution. So why don't we have Molly transition to the next slide?
Thanks, Molly.
Yeah,
Dave.
I just have one more. It's just another illustration. And this is something that I actually presented a couple of months ago, and I've just updated the premium. So this table compares the 2025 rates for UMP Medicare with creditable drug coverage. So that's our current benefit for 2024. To UMP with Part D, which will be our benefit in 2025. So on the left is what retirees in UMP would pay in 2025 if the board had not approved the change to Part D. The right is what they will pay instead with the change to Part D and the revision to the previously authorized premium on July 11th. So walking through the figures, we see that there's a difference of $285 between the two 2025 bid rates, creditable coverage on the left versus Part D, UMP with Part D on the right. And if we subtract the explicit subsidy of $183, that results in the 2025 premiums outlined and in bold. So just over $700 for the current benefit with credible drug coverage versus about $420 with UMP, with the future benefit for UMP with Part D. If we compare these premiums to what members are paying right now in 2024, that's about $533. The current plan with credible drug coverage would have increased by $171. Whereas the future plan that has been approved by the board is decreasing by about $113. So when you saw this slide last time, that $113 in red was $80. So the savings have increased with this revision to the premium.
And Molly, that's the point I really want to drive home, is that negative $113.58 is the real life experience of what somebody is paying today versus paying tomorrow under this plan. The rest of it, the $171.03, is cost avoidance that they would have paid, but from today's like actually writing checks or having an electronic deduction from a pension or from their bank account, it drops in the real life experience by $113.58 now.
Thank you, Molly and Dave. This is a great slide, and it's just fabulous that you all were so on top of this issue. And Dave, I would like to just commend you because you continued putting steady pressure on CMS, and you can't help but believe all this isn't adding up. So thanks to both of you. Molly, do you have another slide?
The next slide is the resolution language. So I think I will transition over to you, Chair Birch.
Thank you, Molly. At this point, I'd like to call for a vote on Resolution PEB 2024-37, amending Resolution PEB 2024-36, the Uniform Medical Plan, otherwise known as UMP, 2025 Medicare Premium. Resolved that Resolution PEB 2024-36 is amended to add as presented at the August 5th, 2024 board meeting, so that PEB 2024-36 now reads, the PEB board authorizes the Uniform Medical Plan, UMP, Classic Medicare with Part D, PDP premium, as presented at the August 5th, 2024 board meeting. Is there a motion to adopt?
So moved.
Thank you, Elliot. Is there a second?
Second.
Thank you. I think that was Tom.
It was Tom.
Thank you. Are there any comments from the audience at this point? If you'll signify by raising your hand, and Jessica, if you and the staff will help me with the lineup. I think there's just celebrations going on. I don't see
we don't see any hands.
All right. Since we have no public comment at this point.
We do have a public comment now, Sue.
Okay, hold on. It is
Christine Clark.
Christine Clark. Go ahead. Please open your mic, identify yourself, your affiliation, and share with us your comment.
It worked. This is Christine Clark, member of RPEC, Chapter 13 in Northeast Washington State. We're still kind of puzzled about the Part D benefit. You know, I don't understand exactly what's changing. Has MODA come out with an easy to understand description?
Thank you for that question, Christine. And Dave, I'm going to just give an encapsulation to this response, although oftentimes, Christine, we don't respond necessarily to questions, but I think it's pertinent for you to understand. The federal government has created, with 1 week's notice, an opportunity for plans such as ours to get to participate in a demonstration, which creates greater savings. We are having a special board meeting to adopt this so we can help our members save additional dollars. And MODA is our agent, if you will. They will register to be part of the demonstration, but this action we're taking today gives the power for MODA to go forward, participate in the demonstration so they can pass these savings down to our retiree members. Does that help, Christine?
Kinda. So
Okay, and we'll have other written information for you. We can't say why exactly CMS is doing this, but we want to act on it so that we get these savings through. So at this point, I'd like to see, are there any other comments from the audience?
Thank you.
Christine, if you'll lower your hand. Thank you.
I did. Yeah.
All right, seeing none, are there any comments from the board? All right, we are going to do a roll call vote. Harry Bossy.
Yes.
Tom McRobert.
Affirmative.
Michaela Dolman.
Yes.
Elliot Weinstein.
Yes.
John doesn't vote. Kurt Spiegel. I don't think Kurt has joined. Sharon Lang is not joined us, I believe. And this is Sue Birch. I enthusiastically vote yes. So resolution 2024-37 passes. And thank you, staff, again, Dave, for your leadership and working with everybody to get this pulled together with such quick notice. It's great news.
And
Dave,
Chair Birch, I'll just say one more piece that I appreciate everyone scrambling for a board meeting, that we were able to get quorum, have a positive vote. We are thinking as a breadcrumb that I'm going to pick up next board season, think structurally about the resolution and how we can have the board, when you're approving the Medicare rate specifically for UMP, to make it, we're thinking preliminarily, we'll think about this over the next couple of months. We have a whole board season to go, about you passing a not to exceed rate, because CMS often produces things related to the Part D plan in late July, early August. And it just, if there's a way to give the agency flexibility to lower rates later in the summer after the board acts, then we don't have to scramble and surprise you with a meeting. So we're just thinking about that as a structural piece. So just to provide you with that context, that we might think about the syntax of the resolution differently in the future for that reason. But that's tomorrow's problem or question, not a thing for today, just a breadcrumb.
Thank you, Dave. And also, I bet Molly could crunch some numbers and show the total amount of savings we just created as a board for our retirees, because I think if she can't crunch that right now, it'd be great to report that out next time, because this is significant. We like premiums moving in this direction. So kudos to the whole team. And yeah, let's go ahead and, because I don't think Molly's, she's running those numbers in her head right now. But
I think the best thing to say, Sue, is think about the rate reduction that the board just passed is the equivalent of almost a month in premium that would have otherwise been paid next year. It's about $408 less, and monthly premium is now closer to $419. So it's almost like the board just saved everyone who's enrolling in UMP Classic Part D a month's premium next year.
yes, and Dave, I mean the aggregate number for the total number of retirees, because I can't remember if our count on UMP is 80,000.
No, it's about 40,000. So
40,000.
a good proxy would be 40,000 times 400.
Great. We like to save people a lot of money. All right, we're going to move into public comment. We've now reached this section of our meeting. It's the public comment period. If there is anyone on Zoom that would like to provide comments, and if there's anybody on site, Dave is going to tell me. I'd like to first gather a list of speakers to effectively manage our time. We ask, if you're going to speak, that you identify yourself and your affiliation, and that you keep your comments to about 2-3 minutes. Dave, I am not seeing any hands on the big screen. What do we got going on in the room?
We just have we have HCA staff and one special guest, but she's not speaking. Connie attended the board meeting. She was so excited about premium rates and seeing people that she decided to attend a special board meeting.
Oh, Connie, hi.
But she didn't sign up for public comment.
All right, I'm going to give it just another minute to see if any hands are flying up. I think people are going out to breakfast knowing that we saved them some money.
Mm-hmm.
I think people are going out to just celebrate a little. All right. I think we don't have any public comments. Again, board members, thank you for your time. I'm going to go ahead and start closing our meeting now. I want to remind you that it concludes now our special PEB board meeting. Our next meeting will be the board retreat on January 30th, 2025, with the same format of attendance in person or via Zoom. And Dave, are there any final comments before we adjourn for the season?
Just
Yes.
thank you again. We're re-adjourning for this season, but it was an important thing to get together, an important advancement, and just appreciate everyone making the time to join this morning before the CMS deadline.
Fabulous. All right. This meeting is adjourned. Thanks all for participating.
Thank you.